Well, the doctor is in now with new hope for people who battle addiction. It is a drug now used to treat high blood pressure. In experiments on mice, researchers found the drug helps erase the unconscious ties between triggers like sights and sounds and that cravings that can lead to a relapse. Here to explain how it might help humans, Dr. Stephen Reisman, cardiologist and director of the New York Cardiac Diagnostic Center. So basically, they got rodents addicted to cocaine and alcohol. Then they treated them with what's now a blood pressure drug, right?
Correct. They used a drug that's not commonly used anymore, isradipine, similar to amlodipine or nifedipine. They get them addicted to either cocaine or alcohol. They follow a pattern. They pick a particular colored room, black or white. Then they give them the medication in a relatively high dose, and they unlearn or forget this memory of going for the same colored room, suggesting that this addiction pattern may have been broken.
Because in humans, as I understand it, the theory is that the drugs alter the chemical pathways in the brain so that you come to associate getting high or some of the triggers that are around you when you're getting high, music or lights or whatever, you come to associate that with pleasurable feelings. If you can break that connection, you can break that memory, if you will, you have the potential to treat the addiction.
Similar to Pavlov's dog, where they would, basically the dog would keep on getting food and they would hear a whistle. Then they stopped giving the food, but with the whistle, the dog would still salivate. There's a memory there. So in this particular experiment, what they did is they used a calcium channel blocker, which blocks the intake of calcium into the cells, somehow disrupting, supposedly, the memory of addiction and breaking that particular cycle. The problem with this study, though, is that it was only in rats, and we don't know if it applies to humans. And furthermore, it's a relatively high dose of the medication, which can cause significant side effects in humans. So I think another study to reproduce these results in animals would be appropriate, and then to try it out in humans and see if it works.
The drug has already been approved for human use, but again, in blood pressure cases.
Correct.
So in order to get it approved as a potential treatment for addiction, how much of a lift is that going to be?
I think they're going to, well, it depends what dose they're going to use, because if they're going to use it in a higher dose, it may have more side effects and actually may require a second drug to, bring the blood pressure back up again. So it gets really complicated, and it really depends on dosage and, an experiment in humans to see if it has the same effect as in rats.
Let's hope there's some promise there. Dr. Stephen Reisman.
Sounds like it. Thank you.